limb ischemia and severe peripheral arterial disease leads to non-traumatic amputations. 80% of those amputations are preventable if identified early enough. Our patients that end up with vascular disease usually have a lot of comorbidities, a lot of medical problems. And so over the years, that's how they build up the plaque, and that's how their arteries get diseased, and eventually they start to get symptoms from it.
Some possible symptoms could be things like, complaining of pain in their legs when they're walking around. Additionally, it could be things like noticing that wounds on their legs aren't healing as you would expect.
For that group of patients, for me, a good outcome is never doing surgery on them, is getting them to quit smoking, is getting them to change their diet, change their lifestyle. If you walk and you push through the pain, then maybe your main highway is occluded, but your side roads open up and they can take over the supply of blood flow. We do end up seeing the complex patients because it takes that complexity for them to develop the bad vascular disease, which then leads them to our door. One of those patients is Mrs. Claudette, and she has had a wound on her ankle since 1961.
8 doctors had gotten together for a consultation, and 7 doctors said to amputate my foot. One of these surgeons was really a specialist in ankles. He said, you know that you would probably better off with a plastic foot. And I said to him, where would you amputate if you had to? And he said, oh, here. When he touched me, I said, no way. There is no way. I will never have it amputated. I will die first.
In terms of amputation, it is, in severe cases, necessary intervention, but again, one that I think the healthcare team in general and the patient themselves is striving to avoid.
A lot of the time in traditional vascular surgery, we only get involved when someone tells us they need a revascularization. But in fact, I find that vascular surgeons are pretty good quarterbacks for their whole journey. So in their cases, it's not necessarily an intervention that I look for, but rather wound healing.
Plastic surgeons generally are thought to be the reconstructive surgeons. We make things heal, we do skin grafts. But if there's not adequate perfusion, then no wound will heal. If you don't water the grass, it won't grow.
It tends to come back because those blood vessels, they still have years to live, and then they can build more plaque before the intervention, after the intervention, around the intervention. So we always have to keep eyes on them, and the patients keep coming back again and again. That's when we start talking about the multidisciplinary team to take care of them, because it's not just about the blood flow, it's about the bones, it's about the infection, it's about their social history, it's about the dressings that they need to put on the leg. The problem that I find is that everyone works in a silo.
The vascular surgeon does their part, and then the patient is expected to go to see their family doctor, for example, who then will try to optimize their health conditions, get them to manage their sugars better, get them to stop smoking. And then, in terms of wound care, they're passed along to a wound care clinic. And there's not necessarily a lot of communication between all of the providers that are necessary to, again, affect the best possible outcome.
We kind of see patients in snippets, and then they get lost through the web that is our healthcare system. And one of the biggest challenges is having that continuity of care.
So even though the vascular surgeon or interventional radiologist or interventional cardiologist believes that the patient needs to be medically optimized, believes that the patient needs to quit smoking, they're not able to provide the patient with the support and the medical care to actually get to that point. And they assume that their primary care physician will do it, but the primary care physician is already overburdened and burning out from all of the other issues they have to take care of.
It's unfortunate that the system doesn't have something in between. I've seen vascular surgeons before. I probably saw half a dozen, but all they did was do the test for the blood flow, get the results, and tell me.
So it does wear on you if you just focus in the operating room, if all you're doing is a surgical intervention, because it seems that it's just like repetitive and it's a grind and it's always reacting to problems and not really a capacity to prevent them from happening in the first place.